All right, so this is the part 1 and 2 for the pharmacy profession or the profession of pharmacy, which is chapter 1 in your blue pharmacy practice for technician books. We're going to do this part here. So the first one kind of takes it back to the origins of pharmacy. So early medication and formularies have been discovered all the way back to for centuries. During that time, the idea behind this is to show you how things have evolved over time. So, centuries ago, sicknesses were thought to be a curse. Many different religions and areas and individuals and civilizations believed that illnesses or people getting sick were as a result of curses, not necessarily illness or bacteria or diseases. Medicinal preparations were used in combination with prayers and chants and different rituals that were used. The preparations back then were obviously not drugs that we use now, but they were different drugs of their own time. So they were derived from things like plants and animals and minerals. Clay tablets can be traced back more than 5,000 years ago that actually had a list of medicinal preparations that were used during this time, and that is what is actually provided the basis for the modern day formulary. So traditional Eastern medicine. So for traditional Eastern medicine, it relies on plant products and healing energies. Some plants are still used in Western culture today. So, for example, we use ginseng as an alternative therapy. St. John's wort, digoxin, which is a actual prescription drug that is used to treat congestive heart failure, is derived from the foxglove plant. So there's still some things in use today that we use that are still plant-based or naturally derived source. Western medicine is a less religion-based and it's more dependent on observation, theories and hypotheses, and scientific experimentation. So Hippocrates is known as the father of modern medicine. He was a Greek physician who thought that disease actually had a physical explanation, and that's kind of how things evolved from there. So Galen is known as the father of pharmacy. He was also a Greek physician, but he studied the effects of herbs on the body, which has led to kind of where we're at now. So his practices were transitioned into what we saw early on in what we call the alchemy days. So you had a chemist who would have been considered a pharmacist at this time, and the chemist had an apprentice, which would be considered the pharmacy technician. Most of these were individuals that own their own shops, and people would come in and see them because most times they couldn't afford a physician even back then. So they created medications and created treatments by practicing creating different medicinal extracts from different plants. So the Middle Ages, the ethics regarding care have been an ancient and a cross-cultural part of pharmacy. So early Arabic civilizations were actually the first to develop lists of drugs with dosage formulations. They also identified pharmacists as qualified healthcare professionals. In Jerusalem and Egypt, the government established hospitals, and these facilities served both the rich and the poor, both men and women. They had separate wings for different kinds of surgery and care. And it really kind of set the basis of how our healthcare systems are set up now. And 11th and 12th century Europe, so apothecaries and the first professional guilds were developed. So during the Renaissance, alchemy was on the rise when scientific thinking was on the decline. In your Renaissance apothecary guilds, They oversaw apprentice training programs and set standards for the position or for the profession. So again, the chemist, who was the owner of the facility, would be considered the pharmacist, and the apprentice, who was training to become the next chemist, was known as the apprentice, which would have been more along the lines of what the pharmacy technicians do nowadays. This Renaissance apothecary guild was considered the precursors to modern pharmacy associations and state boards of pharmacy. So in the 17th century, there was a scientific revolution. So many new scientific terms were developed with both Latin and Greek roots. Excuse me. Wrong way. So colonial herbs and apothecary. So Native Americans have been in North America for centuries. They have, during that whole entire time, and still continue through to this day, practice herbal medicine. One example is they use a local plant called the purple coneflower that we actually call euchinacea now. And when we the settlers from Europe arrived on the continent, the Native Americans actually shared this information with the colonists. So profession of medicine will gradually separated from that of the pharmacy. So early on, when you had a facility or a mom and pop spot where the pharmacist or chemist was creating his own concoctions, again, many people or many individuals would go see that person because they couldn't afford a physician. Back then, there was no regulations like the FDA, which is the Food and Drug Administration, the DEA, anything like that. And believe it or not, many of the tinctures, many of the things that were made had a lot of opium in it. Some of the things had, poisonous ingredients. Cyanide was used in a lot of the creams because they didn't understand that those things were dangerous. They didn't understand that the opium was addictive and anything like that. They were just using and pulling all of these different things together, and there was no regulatory bodies established during that time to say, hey, we need to take public safety into consideration. The United States Pharmacopoeia, known as the USP, is a formulary of drug standards. This is still used today, and it was developed in 1820. So the first U.S. pharmacy school was a college, Philadelphia College of Pharmacy, that actually opened up in 1822. The American Pharmacist Association was formed in 1852 to address adulteration of imported drugs and develop professional practice standards. So 1852 was really the earliest that we had any recognition that there should be formal schooling, that there should be certain standards and guidelines set for who's practicing, how they're practicing, what is being dispensed. In the 19th century, pharmacists gained recognition as healthcare providers. Physicians still operated most of the apothecaries. Pharmacy training programs focused on pharmacognosy, which is a study of medicinal functions of natural products and chemicals of animal, plant, and mineral origins. So we're going to pause on slide 11, so that'll get you through. Be sure to read your readings in the books as well. But as time has evolved, so up to 2010, I believe, any individual could go to pharmacy school to become a pharmacist and get a bachelor's degree, which was much less schooling. But in 2010, they changed the requirements. So any pharmacist that is graduating from pharmacy school after 2010 is required to get a PhD or their doctorate. So it's a much longer time of school. As we're going on now, they're starting more requirements for pharmacy technicians. In the state of Arizona, we can work as pharmacy technicians as a trainee for 3 years. After 3 years, you must become certified. To become certified now, as of January 1st, 2020, you must have gone through some sort of schooling or education program to sit for your board exam. So it's a really good thing that you're coming into the program now. This program will give you everything you need to be able to pass your PTCB exam and become certified. We have you schedule that before you go out onto extern. And the reason for that is the sooner you take your exam, the sooner you become certified. You get to work in much different areas, or you have much more options of where you can work because you're certified. Also, your pay is increased. You're viewed as a professional with education, and you are certified. You've taken the exam, and you've gotten your certified pharmacy license from you've gotten a certification through the PTCB, and you've also received your certified pharmacy technician license from the Arizona State Board of Pharmacy. Most of this is required to work in most pharmacies, and you do get a pay difference. So it's really interesting how things have evolved. We are still, as technicians, fighting for more requirements for education, because you have to stop and think. One small error can be a fatal error in pharmacy. One small error of, oops, you put the wrong pill in the bottle, or you made the wrong pharmacy math calculations. Those can have devastating and fatal consequences to our patients. So the more we're educated, the more we're required to pass exams and know our stuff, the better off we are going to be. We're going to be recognized as more healthcare providers, professionals, and also more for our patients' safety. So again, this goes through slide 11. Read through that, read through your chapters, complete your daily assignments. Please don't hesitate to contact me if you have any questions.